Welcome to the Maternity Mentor. Today we will be talking about glucose tolerance testing and why this one simple procedure can protect you and your baby from becoming a high-risk pregnancy. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Gestational diabetes is a serious disease that can cause many complications with your pregnancy. It is diagnosed using a glucose tolerance test. Let's explore what a glucose tolerance test is and how to prepare for one. According to the Centers for Disease Control, or CDC, 6 to 9% of women will develop gestational diabetes during their pregnancy. Gestational diabetes can cause many complications for both mother and baby, including macrosomia, or large baby, leading to the need for a cesarean section, high blood pressure or preeclampsia, perinatal or postpartum depression, shoulder dystocia, which is when the shoulder gets caught in the pelvis during a vaginal delivery, premature birth, breathing problems in the baby, low blood sugar in the baby, jaundice, and unfortunately even stillbirth. The glucose tolerance test identifies malfunctions in how your body handles glucose or sugar after you have eaten a meal. This leads to the diagnosis of gestational diabetes. The earlier gestational diabetes is detected, the earlier it can be treated. The American College of Obstetricians and Gynecologists, or ACOG, has recognized the risks to both mothers and babies caused by gestational diabetes. ACOG recommends all pregnant women be screened for gestational diabetes between 24 and 28 weeks gestation using a 1-hour glucose challenge test. If you fail this test, your provider should order a 3-hour glucose tolerance test. Some healthcare providers may screen earlier using the 3-hour glucose tolerance test if other risk factors are present, including obesity, a family history of diabetes, if you have high blood pressure, if you have high triglycerides, if you're 35 years of age or older, if you have polycystic ovarian syndrome, if you have delivered a previous baby that weighed greater than 9 pounds, or if you have a history of gestational diabetes with a previous pregnancy. The glucose challenge screening is simple. You start by drinking a very sweet glucose drink, which is like flat soda. It can come in a variety of flavors, but orange flavor is the most common. You wait 1 hour and then your blood is drawn. You will need to drink the liquid rather quickly, so many women just chug it. Some women may feel a little nauseous, but most have little problem with the test. If your results are high, or if you have other risk factors, a 3-hour glucose tolerance test is ordered. This test is looking to see if your body is producing adequate insulin to handle extra glucose in the system. The 3-hour test starts with you fasting overnight, which means you don't eat or drink anything after midnight. Your blood gets drawn first thing in the morning. Then you will drink a different solution that has more glucose in it. Your blood will then get drawn at 1 hour, 2 hours, and 3 hours after you drink the solution for a total of 4 blood draws. There are no significant risks associated with this test other than possibly a little nausea, a tangy taste in your mouth, or maybe a bruise from the blood draws. Occasionally, you may feel lightheaded or dizzy at the end of the test. So bring snacks to eat when you are finished or have someone drive you home. Before we continue, please remember to hit the like button and subscribe so you can get the latest content to have a happy and healthy family. Now let's talk about test results. If any results are higher than normal, your doctor may choose to retest you again in 4 weeks. If 2 or more of the levels are higher, you will be diagnosed with gestational diabetes. The following levels are considered normal. Fasting, which is the blood drawn before you eat, lower than 95 milligrams per deciliter. 1 hour lower than 180 milligrams per deciliter, 2 hour lower than 155 milligrams per deciliter, and 3 hour lower than 140 milligrams per deciliter. Please remember, your healthcare professional may diagnose you with gestational diabetes with only one abnormal result, or they may not diagnose you with 2 abnormal results. They are aware of your entire medical history and pregnancy condition, and they are the best expert to determine if you have gestational diabetes after reviewing your entire clinical picture. If you are diagnosed with gestational diabetes, your healthcare provider will probably refer you to a perinatologist or maternal fetal medicine physician to help guide your pregnancy care. This is because you may be considered to have a high-risk pregnancy after your diagnosis. Your physician will probably have you start tracking your blood sugar many times per day. They will provide you with a machine you can use at home and instruct you on how to use it. Your physician will also check your urine for sugar at every visit. Sugar in your urine can be a sign that your diabetes is not under control. You will also need to see a nutritionist who can help teach you what you should and should not eat while pregnant with gestational diabetes. Eating the right types and portions of food can help you keep your diabetes under control. Your physician will probably also develop a safe exercise program to help with your glucose control. The good news is that gestational diabetes is easily managed with diet and exercise. When in control, women can have normal pregnancies and healthy babies. Gestational diabetes is a serious condition affecting numerous pregnancies. However, timely diagnosis using a glucose tolerance test can prevent complications for both mom and baby. I hope this has explained why your healthcare provider is ordering a glucose tolerance test and helped you to know what to expect when having a glucose tolerance test. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.